This station here will be the adult endotracheal skill station. Again, this station we are not going to be wearing the proper PPE that you would normally wear in a skill like this. We won't have goggles or our gloves on as we're doing it. First thing you do is you confirm your patient is unresponsive, not breathing. You would direct somebody at this point to start bagging them while you get your equipment ready. You would first want to put a oral airway in, put it towards the top, rotate it as you go in, and this will keep the tongue back and allow easier bagging of your patient while you're preparing. At this point, you'll get your equipment out. You'll need your stethoscope to be able to check the lung sounds when you're done, a commercial securing device, a telemetric device, your laryngoscope with your choice of blade. You can use either the Miller or the Mac blade, your ET tube with a stylet. When you're all ready, you'll check to ensure that you have your light that comes on with your laryngoscope and that it's on tight and everything is ready. And then when you're ready to intubate, you'll notify the person who's been bagging for you. Ready? I am ready. You'll come around, you'll go in, you'll look for your vocal cords, you'll pass your tube. This would normally be on. Blow up the balloon. You never want to let go of your tube anytime during this. Check for lung sounds, upper, lower, and over the stomach to ensure no gastric sounds. At this point, you'll take your colorimetric device, you'll want to give it 4 or 5 breaths with the BVM and look for a color change. If it turns yellow, you have a good tube. If it is purple, you need to recess and replace the tube because you're not in the esophagus. After confirmed, you take your commercial device, tighten it down to where it holds in place, but not so tight that you clamp the tube off. Bring it around the back, secure it.
And you also want to make sure that once you have verified by the colorimetric that place waveform capnography from your cardiac monitor or isolated device, you want to make sure you're monitoring end-tidal CO2 with waveform. That way, if the tube becomes dislodged, you can see quite quickly that that tube has become dislodged, and always make sure you reassess your tube after any movement, or if you follow the DOPE mnemonic, dislodgement, obstruction, pneumothorax, or equipment failure. So if you're having an issue with your ET tube, you want to run through the DOPE algorithm to verify.